चलिए डॉक्टर शिल्पी मोहन मैम के पास किर्गिस्तान में, उसके बाद मोनिका बहल मैम. Monica Bahal ma'am, you would be kind enough to permit me to just take you to Kyrgyzstan. Dr. Shilpi Mohan ma'am.
Good evening, everyone. First of all, I would like to thank Dr. Gulshan Sharma ji for giving me the opportunity to be a part of this August gathering. And I am among such beautiful people, and I'm listening since the program started, and it was really very enlightening to hear all of you. Right from Dr. Bishwajit Saha to Mr. Mohit Sood and Dr. Meena Mishra, then Ms. Shruti Garg and many more. And I'm really extending my heartfelt gratitude to him. So from moving to creative art therapy to medical therapy, so I'll shift to medical therapy, what we can do during this post-pandemic period. The topic which we are dealing with is mental health post-pandemic. So the happy part is the pandemic, now we are labeling as post-pandemic now that it is getting over, and the special focus will be on the students and the educators. We all know that the wellness includes 5 components. So which is the physical component, emotional component, mental, social, and the spiritual component. All these components are there. And if we look at the COVID-19, it has definitely given some positive impact and the negative impact. So I'll just form a mnemonic so as to make it simple for all the listeners. What are the positive impacts and the negative impacts we have got during the COVID-19 pandemic? So C stands for connectivity. We are now better connected. This platform itself is an example that we are better connected. It has connected me to my old college friend, Dr. Meena Mishra. We were in the same college, same hostel, and we spent such beautiful time together. And this platform has connected us together. Even for students and teachers, they are now better connected. They are not just now restricted to the school. They are getting online platforms, but the negative impact is there's a lack of communication and lack of concentration because the students are not talking to each other. They are online. Again, the positive impact is online itself is an add-on platform. The students are now more observant. There is no backbencher kind of a thing which was there in the class. The negative impact is the obsessiveness towards the platform is there. Now, once the shift is there to the offline platform, they are already so obsessed with the online thing that the shift is now becoming more difficult for both the student and the teachers to handle. And there is so much of overexposure of things on the online platform that it is difficult to demarcate what is good and what is bad. V stands for variability, which includes both the things which I have talked upon and listed upon above. The negative impact, it has become a virtual reality. The virtual world itself seems real, although the world where we are living itself is a mithya. But then whatever real it is, now we have shifted into further virtual world, which is totally unreal world, which is considered as real by the children. The children have become more inquisitive because there is a new plethora of knowledge for them. But on other aspect, they have become more irritable because they continuously they are on screen. Even for the teachers, it becomes very difficult to manage the students on screen, where they cannot physically see the student what they are doing. Then D stands for dynamism and dealing with the situation. Now the student are in a better condition, and the teachers also are in a better state to deal with the situation because they've already handled one pandemic. So anything which comes in the future, which we all cannot deny that it will not come, we are in a better situation to deal with any impending thing that comes in future. The negative aspect is depression, because prolonged social isolation and lack of communication has led to depression. So the impact on physical and mental health includes irritation, loneliness, boredom, anger, depression, physical inactivity, which leads to cardiac deconditioning. Now you must have heard that when the students are going to the school, they become more tired because now they are not able to deal with the situation, because now their heart has become deconditioned, even the body has become deconditioned. And impending lifestyle diseases, which we're already dealing with as a medical professional, it has become more rampant, and it will be more seen in future, because hypertension, diabetes, obesity in childhood, which we were already dealing with because of the westernization of the society and because of the sedentary lifestyle, we have to deal with in future because of the COVID pandemic. So what are the corrective measures we can do so as to deal with this situation? Again, I'll go back to a mnemonic. C stands for care. As a medical professional, I would like to highlight that we have to take care of, especially of our eyes and hands, because the cervical issues, the carpal tunnel syndrome, which is because of the continuously working on the keyboard, becomes more rampant, especially in the younger age group. There are many patients who are coming to me who have these kind of problems like irritation of the eyes and then pain over the fingers. So we have to teach them about the light exercises and the some light yogas, some eye tonics which they can use, and to maintain their posture in a better way, so that these problems may not become chronic in future. Then O stands for avoid overeating or overindulging into food because of depression, or just to keep themselves occupied, not to overeat, which may lead to obesity. Then very important thing, observe breath. I would recommend to all students and all teachers to, and for everyone, not to take breath for granted. All these lives, all these days, we have taken our breath for granted. The only time we have focused on our breath is when the COVID came, when we realized how important breathing is. Otherwise, it was just something which was going on. But more we focus on our breath, more we focus on our pranic energy, more we concentrate on our breath, better will be our focus, and it is a way to meditate. So if we just teach our students to focus on their breath for 5 minutes and take a break in between just to focus on breath, their anxiety will reduce, their irritability will reduce, and the concentration will improve. Because the thing is, when we focus on our breath, then we improve our oxygenation, and brain and all the cells of our body requires oxygenation. We know this much better after COVID, that how important oxygen is for our body. So more we focus on that, more we improve our inhalation and exhalation process, better will be for us to deal with any pandemic or anything in future. Be it a mental condition or physical condition, we'll be in a better position to deal with that. Then V stands for intake of vitamins, vegetables, and supplements, which we should improve so as to improve the general condition. I stands for improving water intake, which is a must. As a medical professional, I must tell all the students who are listening and everyone that water intake is very, very important, because this will prevent many of the diseases which can happen just by low water intake. Then D stands for vitamin D, which is very, very important. See, all these times we were thinking that vitamin D is something which is related to bone health. We should take vitamin D so that bone health should be good, and for proper absorption of calcium. That was what everybody knew. But I must re-emphasize on this platform that vitamin D is very, very important for mental health. Not just mental health, even for any respiratory diseases, diabetes, hypertension, cancer, for everything, vitamin D is very, very important. Just to give you food for thought, why this COVID became so rampant? Because one of the factor was, all across you must have seen that vitamin D was deficient, which made us more prone for any seasonal diseases and for any respiratory diseases. And that is why we got more impacted by the COVID. Not only that, because of the vitamin D deficiency, neurodegenerative disorders, depressive disorders, schizophrenia, all these things are becoming more common, and we just consider it as something very, very small. But if we deal with vitamin D related diseases, and if we deal with this simple factor, we can deal with many diseases like depression, hypertension, diabetes, respiratory diseases, cancer, early aging, bone health, everything can be dealt by just concentrating on whether are we really deficient in vitamin D or not. And what can be done for a corrective measure? Periodic investigation is required. This is a platform where I must say, as a medical professional, that we should subject not only teachers, but even students for periodic evaluation of certain vitamin deficiencies like B12, vitamin D, which if corrected, iron, which if corrected can give very good result for mental and physical health. Then we should give them some vitamin D rich food like mushrooms, eggs, milk, fatty fish, fortified eggs, then fortified yogurts, all these things, and exposing them to the sun for some period of time so that they can get vitamin D, get them evaluated, and if they are deficient, supplement them by proper medications. So the take-home message is, COVID is an adversity, as we are doing now, as Dr. Gulshan Sharma is doing. He is the best example of capitalizing the adversity. So we should capitalize the adversity, open the channel of communication between students, teachers, and parents. That is what O stands for. V stands for visualize the health issues and work upon them before it gets too late, because what children are now, they are the future of India. So better we work upon their health issues now, rather than just thinking that they are not going to have any health issues. Health issues are something which affect the older age group. If we concentrate on their health issues now, we will make better Indian citizens and better people for the world to see in future. Then I stands for improve mental and physical health by simple tips, which I have mentioned, which has come to me. There are many more which are there. And D stands for do yoga. I am a proponent of yoga. I would, on this platform, request all the students and all the teachers to spare 5 minutes or 10 minutes, whatever is possible for them, to inculcate yoga as a part of their daily curriculum. Thank you for your patient listening.